Hi, everyone. Welcome back to our series on heart disease and stroke. The six-step prevention plan is what we're focusing on last week and this week. This is based on the information I gathered from the book Healthy Heart, Healthy Brain by Doctors Bradley Bale and Amy Doneen. For those of you who don't know, my name is Linnea Baker. I am a board-certified family nurse practitioner. I absolutely am passionate about education and bringing value to others to help you on your personal health journeys and to help you advocate for your health and wellness. So I just want to thank you for giving me some of your valuable time tonight and leaning in and listening to some important information that really can impact your overall health in this area. So we said that the six-step prevention plan that Dr. Bale and Doctors Doneen came up with has the acronym EDFROG. And we said E is for education, and we covered that last week. So if you didn't see that one, go back and watch that. D is for disease. We're going to cover that one today. F is for fire. That will be next week. Then the R is root causes, O is optimal care, and G is genetics. So when we talk about step 2 of this six-step prevention plan by Doctors Bale and Doneen, we're talking about that second step, disease. First, it's important to know that in the statistics, approximately 50% of men and 70% of women who die suddenly from coronary artery disease never had any previous symptoms, no symptoms. We talked about that a little bit last week when we talked about education. We said that there's a lot of a high number of silent heart attacks and silent strokes. So 50% in men, 70% in women who die suddenly from coronary artery disease never had a symptom prior. And that would be your warning signs, right? To get in and see a healthcare provider, and they didn't have that. In up to 99% of cases, the plaque does not obstruct the blood flow. So tests like the treadmill stress test, which is very common. I've had a treadmill stress test. Working in cardiology for as long as I did, I've worked with patients on treadmill stress tests. I've been in the room doing the tests with them. The treadmill stress test, that's the standard of one of the ways we evaluate for coronary artery disease and heart disease. That evaluates blood flow. And because 99% of the cases of the plaque does not obstruct the blood flow, it's not blocking off the inner tubing of the artery where the blood's flowing through, you can really miss that disease in 99% of cases. And that's really scary. So early detection is key. Remember last week, just to give you a reminder, we said that most heart attacks and strokes are caused by inflammation. That's that fire in the chronic inflammation in the artery wall that sets us up for these heart disease and arterial disease and risk chronic disease things that we talked about last week, like strokes and heart disease. So they're caused by inflammation of the plaque in the artery wall. And when that inflammation occurs and that plaque's in the artery wall, it can rupture explosively like a volcano. So it's not because it's obstructing the blood flow, it's because it's inflamed in the artery wall, the plaque that's getting in there, and then it just ruptures and explosively blocks off after it ruptures the blood flow. It's not because it's slowly obstructing the tube, okay? And then we said that 86% of heart attacks occur in patients whose coronary arteries are less than 70% blocked. And if you remember, the standard of care is they would say you have mild disease. It's not an issue if your arteries are blocked less than 70%. That was kind of the gold standard and still is followed by many cardiologists and healthcare providers. And we said there's no such thing as mild disease, just like there's no such thing as I might be pregnant. You're either pregnant or you're not. You either have heart disease or coronary artery disease or you don't. There's no such thing as mild. We also said that 68% of heart attacks occur in the major arteries supplying blood to the heart that are less than 50% blocked, guys. So you understand now when we talk about being aggressive with identifying the disease, what we're currently using as the standard, like the treadmill stress test, is missing a high number of cases, and up to 99 percent of cases, we said that the plaque's not obstructing the blood flow. So the treadmill stress test would miss that because that's what it's looking for. So we need better tests to do earlier detection to recognize that we're a ticking time bomb, because the disease that's causing the heart attacks is happening when there's not a huge amount of blockage in the artery. So we have to switch our thinking and get more aggressive in our in identifying the disease at an earlier place, or even identifying when we have chronic inflammation before the plaque and disease has even occurred. So when we talk about the disease, in standard of care, they say that patients are quote unquote innocent of cardiovascular disease unless they have specific risk factors, right? So we assume everyone is healthy, no cardiovascular disease, unless certain risk factors come up. And then we start thinking about how we're going to screen them and when we start screening them, what age. But in the Bell-Donin method, they actually assume that all patients are guilty of having silent, potentially lethal plaque until proven innocent by specific tests that check directly for arterial disease. And they're using different tests. And I love that because we're seeing how fast, one, cardiovascular disease is the #1 cause of death in the United States. Two, we know that in the United States, we're very unhealthy. I've told you guys before that the United States is first in healthcare expenditure per person, but we are ranked, and that's globally, worldwide, but we are ranked in the United States 31st for longevity worldwide. So there's a problem in our system, right? We don't have the longevity, yet we have the healthcare resources. We've talked about how strokes and atherosclerosis and heart disease is on the rise in younger and younger men and women. So it's great to be more aggressive. And I love how the Bell-Donin method says you're guilty until proven innocent, based on some basic tests that they do that are different than what the standards of care are now. So what is the #1 best way, or not even the #1, I'm sorry, but what is one of the best ways to check for arterial plaque? And that's an ultrasound exam of your neck, according to Doctors Bell and Donin in their research. And in your neck, you have carotid arteries, and they're saying do an ultrasound of the carotid arteries in your neck. So if you're a female and you've been pregnant, you get an ultrasound of your belly, of the baby, and it's just some gel with a little wand device that it's a transducer that sends images to a screen that can look at the baby. Well, in this case, you can get an echo of your heart. In this case, it's an ultrasound of your neck arteries. It's non-invasive, okay? No needles or anything. It's very safe. And the medical name for this test is called carotid intima media thickness, or CIMT. So when we talk about the carotid intima media thickness ultrasound, it's fast. It can take 15 minutes. It doesn't cause any pain. And it also gives us additional information about our artery age. So if our arteries are more than 8 years or greater than 8 years older than what we are chronologically, we're at risk for developing cardiovascular disease. So if you're 50 years old and you get your neck arteries done with the CIMT ultrasound, and it shows that your arteries are 58 years old, or actually it says greater, so 58 years old in 1 month, or 49 years old, then you're at higher risk of developing cardiovascular disease. Now, if you find when you're doing when the provider and the technician do the ultrasound of the neck, the CIMT, if they find plaque on the CIMT, then you already have coronary cardiovascular disease. It's already there if you have the plaque on the exam. And then any abnormalities in the CIMT measurement is actually linked very strongly to an increased risk for heart attack, strokes, and dementia. Because remember, we talk about brain health as well. So you will know this this is one example of one of the tests they use. There's other things we're going to talk about as we go along from the Healthy Heart, Healthy Brain book. But you better believe I'm getting all my ducks in a row, and I'm going to be going in and requesting some of these tests for myself because I'm 48 years old now. So on the Bell-Donin recommendations, everyone 40 years old and older should get vascular imaging. And again, I have family risk factors and I'm 48 years old. And my husband does as well. He has risk factors and he's 49. So we will both be going in and requesting these tests get done. for our own health and overall well-being. And then if you're under 40 years old, they say if you have red flags, which we're going to go into a little more depth later, because the red flags they talk about are not the typical red flags you would think about. They're those plus more. And so we're going to cover that in a separate topic. So if you have certain red flags and you're under 40 years old, or if you have family history of cardiovascular disease or diabetes, then they recommend, or if you have diabetes, they recommend vascular imaging at an earlier age. So technically, because of my family history, I should have had this done under 40 years old. When we look at the statistics, 20% of all heart attacks occur in both men and women less than 40 years old, guys. That's crazy, because when I was working in cardiology, it used to be a disease of really mostly the elderly. It was rare to see younger people. But as I progressed in my career over the 25 years, yes, younger and younger people, and it's continuing. Stroke rates are up 36% in the age group 18 to 35-year-olds since 2003. That's crazy bananas, guys, because we are, like I said, number one in the world, in the United States, for healthcare expenditure per person. But we're having more and more disease, guys. And this goes into what I talk about, not only being educated in getting in and getting the workups done and catching any kind of disease or sooner, but also having a holistic, healthy lifestyle makes such a huge impact. And our food source and the environment are really impacting our overall decline in this country, in our health. And if you want to live a better, healthier, better quality of life, longer life, you've really got to look at it also from the holistic, healthy lifestyle side, not just medication. It's a combination. Hopefully you're so up on the guidelines and you're taking care of yourself that that they'll catch anything early on. But if you're doing a healthy, holistic lifestyle, you are putting yourselves in the best case scenario to ward off chronic disease. Okay. Because these diseases that are leading causes of death in the United States and that are plaguing the United States, like type 2 diabetes, autoimmune diseases, heart diseases, strokes, all these things, obesity, are coming from lifestyle. Okay. So again, that's the lane I'm in now. I'm on the proactive side instead of the reactive side, but this is so important. And I'm excited about this topic that we're covering now, because it really gives you the tools to go in and advocate for yourself and start having these conversations with your healthcare provider. And then stroke rates are up 43% in the age group 45 to 54-year-olds since 2003. So when we talk about disease, you guys know I want to create generational health, and that's my mission. It's part of my mission for any of you that have been following me or listening to me do these presentations. So, and you know that I spent the most recent part of my nurse practitioner career in pediatrics. So we want to tell parents that we've actually changed. There's different guidelines now that recommend screening children for dyslipidemia, which is abnormalities in cholesterol. So when I was in clinic, we were actually starting to do more routine screening for kids for abnormal cholesterol. And that's because dyslipidemia is a silent disease. And when we were trying to just pick certain kids with certain risk factors, there's just selective screening like that misses a huge number, or a significant number, at least, of children that have abnormal cholesterol. And we know now from studies that half of pediatric patients with dyslipidemia or any kind of abnormal cholesterol will have elevated cholesterol in adulthood. And that leads to an increased risk of atherosclerosis and cardiovascular disease. And it also puts children at risk of premature atherosclerosis and premature ASCVD, or atherosclerotic cardiovascular disease, in adulthood. And we know now that like 1 in 5 kids are overweight or obese. Kids are getting diabetes at a younger age. We're screening for that. They're having abnormal cholesterol levels. So it's very important. And that's why I'm on a mission to talk to you about holistic, healthy lifestyle and a sustainable, healthy lifestyle. Because when I help parents understand how to live healthy, more is caught than taught, and that trickles down to your children. And you will start teaching them healthy habits to help them stay healthy from an early age all the way into adulthood. Because again, guys, the statistics aren't lying. What we're seeing in this country, in the United States, is sad. And that we can break the cycle by being educated. We cannot trust the food on the shelves or in the health food aisle that it's healthy for us. We have to learn how to read labels and educate ourselves on what we're putting in our bodies and feeding our families to decrease the chronic inflammation that we keep talking about, which is setting up the groundwork for all of these chronic diseases. And that's what's going to help your children be healthier as well as yourselves. So the guidelines for screening children, I got this from UpToDate, which is a medical resource we use in healthcare as healthcare providers. And so I took this from there just to give you an idea of what the guidelines are right now. So children who don't have any risk factors, no risk factors for atherosclerotic cardiovascular disease. So for children without any risk factors for premature atherosclerotic cardiovascular disease, they suggest routine screening for dyslipidemia, which is the abnormal cholesterol. So it's cholesterol testing, and that's a fasting test twice during a childhood and late adolescence. Okay. So the first screening they want you to perform through your healthcare provider. So whoever's taking care of your PCM, your primary physician or healthcare provider that's taking care of your children. Between ages 9 and 11, they should get their first screening for cholesterol. And then between ages 17 and 21, their second. And that's because they say in the age group between 12 and 16, they don't recommend screening kids for abnormal cholesterol unless they have risk factors for atherosclerotic cardiovascular disease. So if they have risk factors, that's a different category. This is no risk factors, then don't screen between 12 and 16-year-olds, 12 and 16 years old, because the changes that we have in puberty at that age can cause a different reading on the lipid level or the cholesterol level and have a false negative result. So there's no point in testing it unless they have risk factors, okay? So the takeaway is that in a study comparing the Bale-Donin method of cardiovascular disease screening to current cardiology guidelines, when they looked at the current guidelines for screening cardiovascular disease, it would have missed 86% of people at risk. So the Bale-Donin method is doing screenings on everyone over 40 years old for some kind of imaging to check for arterial disease. We talked about the CIMT, carotid artery neck imaging, as one test today for arterial imaging. But they're saying that typically, they want you to be, they're saying from the Bale-Donin method, you're guilty until proven innocent through these tests, and everyone over 40 should be getting them. And the standard of care has always been you're innocent unless you have risk factors, then we'll start doing some basic screenings, and they're different screenings than what the Bale-Donin method is utilizing. And we also said one of the screenings is a treadmill stress test, and the treadmill stress test it will miss a lot of people who have cardiovascular disease, because we're saying that people who have plaque buildup, even less than 50% are having a high rate of cardiovascular disease, heart attack events, because of the plaque rupture from inflammation in the artery lining. And the way these tests are looking at disease is they're looking at the tube, and they're looking for plaque blockage across the tube versus looking at the lining and seeing what's going on in there. So there's a big difference in what we're going to see. We're not looking at the right things, so we're missing a lot of people with the disease. So I am on a mission to positively impact your health and wellness through education and coaching to create generational health. We just talked about that, right? To help create a generational health and a health span that equals your lifespan. So please reach out to me for a free health consult. You can comment below, or you can private message me. I'd be honored to talk with you. Go in and have these discussions with your personal healthcare provider. Remember, I am not your personal healthcare provider. And so this is educational information only. I'm not here to replace any of the guidance that your personal healthcare provider gave you, because they know you best. But I do want to empower you to have conversations and advocate for yourself in health, and also make sure that the healthcare provider you're with is aligning with what you're wanting in your overall health journey. And different providers, different personalities. Everyone follows a standard of care, but you may fit with a different provider that is more in alignment with what you're looking for. So make sure you're having these conversations, you're following up with your healthcare providers, and just be empowered to take charge of your own health. Okay. And remember that when I talk about this, the topics that we're covering, it comes from this book, Healthy Heart, Healthy Brain by Doctors Bale and Doctors Doneen. This book I got on Amazon. Like I said, I have nothing to do with the book other than I read it. It gets me very excited for the changes that they're recommending that are evidence-based, to help us live longer, healthier, higher quality life. And so I love what they put out. I have a long history in my 25 years. The majority was in cardiology and electrophysiology. And when I get excited about these things, you should be excited, because I've seen things and done this kind of work for a very long time. So I love what they've done with their research. I encourage you to get the book. It is written in layman's terms. You do not have to be medical to understand what they're talking about. It's a great resource or reference to empower you. You can bring it to your healthcare provider and show them what you're looking at and why, to educate them if they haven't seen these guidelines, or not guidelines, but recommendations. You can show them where you're getting it from, and you can read it faster than what I'm doing with these weekly topics. So if there's something that I talked about that's interesting, you can just go ahead and start the process for yourself of how you want to take charge of your health. Okay. Well, I really, really appreciate you guys showing up. And I hope this brought you value, and that you're growing and learning with me, and that you're empowered to have these discussions. So until next time, please be safe and know that I'm grateful for each of you.